The first collection of studies I think I'd like to touch on is a variety of research that's being presented around advances in blood biomarker tests. We know these types of tools and technologies are going to revolutionize how we diagnose and even treat patients, as well as enroll them in clinical trials in the future. These are the types of accessible tools that we know clinicians need at their fingertips to help create an accurate diagnosis for their patients and families and to help navigate them through the healthcare system in a very efficient way. Some of the research that we're seeing presented is really looking at how we implement these types of tools in the clinic. We know that there's been a lot of research conducted to understand both the accuracy and how to standardize some of these types of blood tests, but how do we show that they actually have clinical utility for doctors? And are they helping doctors gain confidence in the ability to diagnose patients more accurately? So some of the research presented is going to be demonstrating that using these types of tools in primary care clinics and even in specialty clinics is helping to improve the accuracy of the diagnosis, helping with physician confidence as well in that diagnosis, and really putting patients on an appropriate referral or treatment pathway. We've also seen that these types of tools are going to really help in even to identify people who may already have not have any symptoms of clinical decline yet, but could be used to help enroll participants into clinical trials that are more of a prevention study type of approach. And we're seeing evidence that's also starting to suggest or model how these types of blood tests can be used by doctors to really improve the wait time for patients in helping to get an accurate diagnosis, either by their primary care physician or a specialty clinician. One of the things that's really important is that we need to continue to do the research that helps to demonstrate how these tests should be used in the clinic and provide evidence for the use of the tools in an appropriate way. So I'm really looking forward to seeing more presentations around utilization of these tools in a doctor's office, but also how do we provide recommendations and even guidelines to clinicians on when they should be using these tools, on which populations they should be using them. So the Alzheimer's Association has been working on a project that's convening a global group of panelists, experts, clinicians in the field that are actually helping to create and update clinical practice guidelines for the use of blood biomarker tests for Alzheimer's disease. So the Alzheimer's and dementia field continues to do more research to understand what's potentially driving risk across every individual and all populations across the globe. We know that exposure to air pollution is bad for our brain health. We've seen in the past, even through large clinical studies that have been presented at the Alzheimer's Association International Conference in 2021, that exposure to fine particulate air pollution is really associated with dementia, and that potentially improving air quality may impact cognitive function. It may even reduce dementia risk. So we are seeing presented at the Alzheimer's Association International Conference this year in 2024, a large long-term study that's reporting for the first time that there may be risk from exposure due to wildfire smoke. And this may be a really big concern, especially because we know that there is an increase and a rise in the number of global incidences of wildfires around the world. We particularly have this issue in our country. There's a number of fires that are happening in California, Alaska, southwestern United States, and Canada. And exposure to the wildfire smoke is an increasing threat to brain health. We know that air pollution, even in states like California, associated with wildfires, now accounts really for more than 70% of the total fine particulate matter that's in the air and the poor air quality days that California is experiencing. So we know this is a real problem. The researchers continue to try to drive towards recommendations on what we might be able to do based on now our understanding that wildfires may be posing a risk to our brain health. They've made some suggestions about how people may be able to lower their risk potentially by updating air filtration systems when possible, by staying inside when the air quality is poor, and also potentially wearing N95 masks when they're outside, when the air quality index reaches over 100. But we know that that's not necessarily always solutions that people can bring into their lifestyle. And this is something that we really have to consider. This large study was looking at socioeconomically diverse individuals across the Kaiser Permanente health system. And we know that many of those individuals that were impacted were also of lower socioeconomic um, population. And that's something that we really have to consider. They may not have the ability to change their air filtration system. They may be renting, they may not have control over these factors. So this is important for us to really think about what the sustainable strategies are in the future for driving down our risk associated with wildfires that may be causing pollution in our home areas. One of the things that we're following quite closely this year at AAIC 2024 is all of the new treatments that are in the clinical trial pipeline. And we're seeing a very diverse clinical trial portfolio for Alzheimer's disease and all dementia. One of the studies that we will see presented is on a drug that is called liraglutide. It is of the GLP-1 receptor agonist class of medications. It's a popular class of drugs that's been already shown to help with diabetes and weight loss and reduce the risk of heart disease. And this is a situation where we're seeing drugs that are potentially being repurposed from other disease areas and tested in Alzheimer's disease and dementia populations. This is going to be a report of a 12-month clinical trial, a phase 2b study that is going to be first reported at AAIC in people with mild Alzheimer's dementia using the liraglutide medication. What they have actually seen in this study is that they've noted that there's reduced loss of brain volume by nearly 50% in parts of the brain that affect memory, learning, language, and decision-making compared to the placebo group. And the results also suggest that liraglutide may protect the brain in people with mild Alzheimer's and reduce cognitive decline as much as 18% after 1 year of treatment. We know that there's a lot that we still need to learn about how these medications actually impact the brain. And there are some potential mechanisms that we think may be involved, such as reducing inflammation, maybe they're lowering insulin resistance within the brain, and really helping with glucose homeostasis, all to be able to hopefully impact the cognition and function of an individual that may be living with Alzheimer's disease or another dementia. So there's more to come for treatments like this, and we hope in the future we'll see a variety of medications like this one maybe in the GLP class, but also others that are approved by the FDA in the future, because we know that it's likely that there's going to be a combination of really powerful, effective treatments that could be used to treat complex diseases like Alzheimer's disease as other types of neurodegenerative disease that cause dementia.